Okay, so hello everyone. Thank you so much for joining in to my YouTube channel. It's a great pleasure to have you all here, and happy Tuesday to all of you. And today is an amazing day. If you don't know me, my name is Ransom Anyema. I'm a medical student studying medical radiography in my third year right now. And apart from my medical studies, I'm also proven writer. And today it's an amazing session. All Med Talks with Saadiya. Hey, Saadiya, could you introduce yourself to the audience?
Hi, yes. Hi, everyone. My name is Sadia. So I started or founded the Invisible Crisis, which is an online platform that talks about living with chronic illness and all the aspects of life and working with a chronic illness, whether that's, managing doctor's appointments, um, talking to your manager about it, talking to your friends about it. And yeah, I post my experiences online on Instagram and LinkedIn as well.
Amazing, amazing. So today is all about Med Talks with Dear, where she's going to answer some questions for the audience answer. Are you ready?
Yes.
All right. So what are the specific strategies do you suggest of maintaining mental wellness while dealing with challenges of a chronic illness? What do you have to say about that?
Yeah, I think the best thing for me has been to surround myself with good people, so and being able to rely on them as well. So strong friendships, family networks. I think it's really difficult to do to live with chronic illness by yourself. And a lot of the times people with chronic illness can feel maybe guilty or ashamed to kind of share their experiences and show weakness or vulnerability. But actually this is a way that you can find support and strength in other people. So I'd say that's the biggest one. And just kind of keep going like with resilience and finding a way to keep pushing forward, even if you get knocked back, not if even if you get knocked down, even that's if that's with your schoolwork or at work with your colleagues or just in general life, I'd say to build a pattern of resilience is really important as well.
Amazing, amazing. Thank you so much for explaining that for us. I believe that Dennis is going to grab something from this. So, okay, so as someone, who advocates about health equity, right? What steps do you believe should be taken to ensure individuals with chronic illnesses receive fair and adequate access to healthcare? So what's your thoughts on that?
Yeah, with health equity, I think it's it can be really difficult, especially depending on where you live. I think where you live has a major impact on the healthcare that you receive, unfortunately, which is obviously not a good thing. So I think online resources is really helpful in order to educate yourself so that you know what you can ask for when you go to the doctor, whether that's a specific test, a blood transfusion, or anything really. Having that knowledge yourself and doing that research yourself is really important to kind of be able to advocate for yourself. And in terms of from the doctor's point of view, I think it's about building trust with the communities around you and listening to your patients. There was a lot of difference in care between, maybe like a white patient versus a black patient or a man versus a woman. And I think being able to understand that that happens and looking out for it and being able to listen to your patients is vital in order to kind of bridge that gap with health equity. But it's really difficult.
Yeah, absolutely. It's really, really difficult, really, really difficult. And thank you so much for answering that question for us. Thank you so much. So I want to, experience, right, as a health advocate. what are the some, effective ways to raise awareness and promote advocacy for chronic illness such as sickle cell anemia?
Yeah, I think the biggest ways that I found is again by just talking to people and being the advocate yourself in your own communities. So, and kind of having conversations about it, but in a casual way. So it doesn't have to be like a big deal. It's just a fact that you have a chronic illness or that you have sickle cell anemia. And I think the more people around you are comfortable with you talking about it, the more they will maybe go away and maybe do their own research and then come back to you and be like, oh, okay, I understand what's happening now. I understand how it affects you. Um, and yeah, I think having platforms like this that you're doing is really important as well to kind of bridge that gap between maybe people who like don't have the knowledge or don't have access to the knowledge. They can come on YouTube or they can go on social media and they can see what people are saying about it. But I would say to be careful about, again, social media because there was a lot of misinformation. So it's definitely, social media is definitely something that is really helpful in this journey. But also there is a lot of information on social media that might not necessarily be useful. So it's about finding reliable sources, again, like yourself, who are actually experienced in this field that can offer insight and advice as well.
Thank you so much. Thank you so much. Tell us about how is the UK healthcare system right now?
Yeah, right now I mean it's making a lot of headlines because of like strikes, so from doctors and nurses. And there is a lot of pressure on the NHS. So the NHS is the National Health Service. It's where you go for free, yeah, healthcare basically. But there is a lot of pressure on it because of the number of people who are seeking health care. And so it can mean for someone like me with sickle cell, when I go to the hospital, it can mean longer waiting times, trying to kind of like, almost like catch doctors or nurses' attention as they're running around and trying to advocate myself while I'm in pain. So it can be difficult, but um, I still think it's a really good service because it's free at the point of entry. So there's no price really that you need to pay. Um, but it's just, I think personally, it's not managed well. And so because of that, there was a lot of pressure on the nurses and the doctors who are just trying to save lives at the end of the day. So yeah, it's a complex situation at the moment.
Yeah, absolutely. Did you say you once suffered from sickle cell anemia?
Yeah, so I have sickle cell anemia. So yeah, it's a genetic blood disorder. And so that's my, I guess, chronic illness.
No, I'm so sorry about that. Could you tell us more about it, your experience thus far, for the audience to grab something from this?
Yeah, so yeah, it's been I guess a bit maybe a bit of a challenge, but it's definitely something that has helped me, like I was saying earlier, learn resilience and the kind of like fight to keep pushing, keep going forward. So with my schoolwork and with my career as well. Um but it's definitely so it's why I'm passionate about kind of talking about chronic illness online because I know that there are a lot of people with sickle cell anemia and a lot of people with other chronic and invisible illnesses too. So, yeah.
Wow, that's that was a terrific experience. So how are you feeling right now?
Yeah, no, I'm good. I mean, if anyone listening has sickle cell, they know that there are kind of like good days and bad days, and I think it's definitely tied to the weather and the season. So currently in the UK, it's winter, so it's a lot colder. So that's a challenge in and of itself, but after so many years of living here. I'm used to used to that experience. So yeah, it's about taking your health seriously as well and looking after yourself, beyond just going to the doctor and getting treatment. You have to, on a daily basis, look after yourself, take your medication, wrap up warm, and again, like ask for help when you need it. So it's just something that you can't do by yourself. Yeah.
Wow, that's cool. Thank you so much for answering that question for us. So another question I have for you is from your perspective, right? As a mental health, wellness advocate, how do individuals with chronic illnesses cultivate a positive mindset and overcome emotional obstacles? So tell us about that.
Um, yeah, I think uh it's a practice, like a daily practice almost. So, there are certain things that we know that we should do for our mental health, whether that's, you know, making sure that you exercise, you eat well, you stay connected with your friends, you give yourself time to rest. But I think it's one thing to know that we need to do these things, and it's a difference to actually do them. And I think sometimes we can be really harsh on ourselves. So it's a daily practice to keep doing these things, even if for that day all you do is like just go for a 10-minute walk. That's still something that will really impact, um, sorry, really impact your mental health in a positive way. Um, and I think it's also about finding things that work for you. So maybe actually you really hate walking, but people are telling you to keep walking or like go to exercise or whatever. So maybe there are certain things that you know that you do. Maybe you really enjoy cooking, and actually when you're cooking, you feel calm and peaceful. So it's about making time and space in your life to do the things that you enjoy, in order to kind of balance out the stressful components with the more relaxing and calming components as well. Um, and I'm a big believer in, for me personally, meditation, but not necessarily meditation where I'm sitting down and I'm just, thinking. For me, I like active meditation. So again, cooking or cleaning or walking because my body is still moving, but my mind has an opportunity to kind of relax and calm down as well. So yeah, it's about finding the techniques that work for you and doing something every day. Again, even if it's really small, to just help you with that.
Wow, that was well explained. Thank you so much, Said here. Thank you so much, for answering that question. You talked about your belief system. Could you tell us your spirit, what you believe in for the audience to know? What do you believe in?
Um, sorry, did I don't as in like my
Your belief system or your spirituality, something.
oh well yeah, I believe that there is a God, and I think that's also another component of it as well. Um, that there's something higher that is in control, and that you can kind of
Yeah.
like um leave your worries or your troubles there. I think that that's really helpful for a lot of people. Having faith and believing in something bigger than you can also help drive your purpose in your life as well, and realize that certain things that either are happening to you or that you've experienced are part of like a bigger picture and part of the bigger story of your life. Um, and sometimes actually you see this when you look back on your life and you can connect the dots of things that have happened, and you're like, oh, okay, so in order for me to be where I am now, these things had to have happened, and maybe at the time you didn't understand, but now you can understand. So yeah, I definitely think having faith and having a belief system is really important.
Yeah, absolutely. You're right. Absolutely. Wow, you've been an amazing speaker, Sadia. Thank you so much for explaining all those questions. For the audience to be enlightened. That's cool. So, the last question before we wrap up the session is, how have you personally navigated the intersection between chronic illness and international living? And what advice can you offer to others with similar situation?
Mm, yeah, that's a good question. I think so as in like living abroad with chronic illness.
Yeah,
Yeah, I think
sure.
that's because I know a lot of people, maybe move abroad for work or for studies. So, and it can be very different to where you grew up. Um, but again, it comes down to research and understanding what the healthcare system is like in a different country, but still maintaining you know, that kind of confidence in yourself to be able to ask for what you need. So whenever I go abroad, I make sure that I maybe know how to kind of like say some medical terms in that language. Maybe if I'm going to like a country where they don't speak English, I try and say some medical terms in that language. I try and, Google where the hospitals are. I connect with my own doctors here, and ask them for advice as well. So again, pulling from your resources and the people in your community, and doing your own research into kind of what the best healthcare is that you can receive abroad.
So what advice could you give someone with similar situation? So what are your advice for them?
Um, yeah, I'd say to yeah, like I said, to kind of do your research in that, but stay connected with your community back home as well. And also in your new country that you're living in to kind of seek out community, seek out people with similar experiences as well. And that way they can connect you. Maybe there's certain schemes or um doctors that you hadn't heard about that they can then put you in contact with.
All right. Thank you so much, for your speeches. Sadia, you've been an amazing guest speaker, and I believe that the audience would definitely grab something off it. So, thank you all for watching. If you like this content, do well to like, subscribe, share to your network, and thank you so much for everything. You can stop recording.
Okay, thank you.